Because usually what happened, the mother can call the ambulance and the child brought to the ED. So the approach is a little bit different. So first of all, in this case, you need to reassure the mother, okay? Why? Because before you're going to take the history, first you have to reassure mother because child may be already in the ED in resus room. Because BRU is a little bit life-threatening, right? So maybe the patient already in the ED in resus room. So you will come up to the mother and take history. But before going for history, you need to reassure mother. So that's why the same introduction when you come up in the room, hello, good morning, good afternoon, anything. So I'm ED registrar, may confirm your name in relation to child, please, and nice to meet you. Then you will reassure mother. Maybe the mother come up to you, where's my child, I'm worried, etc. So you can say your child, Jake is safe with our team, you can see him soon, okay? And then you will go for the helmet. So for, do you know about Jack, maybe? Then she will explain to you. But this question you will not ask in BRUI because you are not going for following a depore, etc. So this is not relevant to BRUI, but this is relevant to febrile seizure because seizure maybe happened already. And the mother bring the child to you now, so you will ask these questions. But in BRUI or all the station, you don't have to ask this question. First, reassure, then you will go for how much so far. Do you know about the Jack condition? We have the station, you will see further, okay? So everything will be clear. Then you will say, I'm sorry to hear that. Then you don't need to go for this question, but you will go for, can you please tell me a little more about this event? Okay. And she will say, yeah, my child was sleeping next to me and I found that the child was some moment unusual, misbehaving, etc. She will, the breathing fast, color change, maybe she will tell him anything like that, okay? So then you will go for the specific question, like where did this happen? Inquire the information more and more. Then you will ask, what were child doing? Sleeping or doing any activity? Maybe the child was in a stroller, you were outside. Okay, this kind of things. Maybe she can tell you. 1 second. Okay. Then you will go for symptoms. You will ask, was he breathing fast? Have you noticed any color change during the event? But because you know that in BRUI, these features are very common. Does he have any jerky movement? For example, excuse me? Does he have any jerky movement or is he flappy? Flappy more likely to indicate like BRUI. Jerky movement maybe is helping you in febrile seizure. Have you noticed any cough or vomiting? Like this kind of question. The duration you need to ask, like how long has this event last? Maybe less than 1 minute or more than 1 minute. If the febrile seizure maybe can be possible, excuse me. Yeah, febrile seizure can be if more than 5 minutes, okay, or less than 5 minutes. This can help you to simple and complex seizure, okay. So this can help you. If the complex, you need to admit the patient. If the simple, you can discharge the patient with safety net. So this can also help you. Did he recover fully? You can ask this question. Any current illness, okay? So is he experiencing sore throat or catch a cold? This also can help you in febrile seizure. Maybe he has a high fever, that's why he has this problem, okay? So this question you need to ask. Another important is systemic review. Systemic review, you need to pick up maybe specific one, not all the systems. Maybe if the febrile seizure, maybe you need to ask any weakness you found, or the child was limping, or any problem in child, any recent trauma. Maybe you can ask this question from here. And miscellaneous can help you to know the temperature. The child had a high temperature. So maybe these two are very important for the febrile, but the rest you can skip. No problem to ask. Only ask 2 system and then leave others. No problem. I just added because all entire systemic review, but you don't have to pick up all. You don't have to go with GIT. You don't need to go urogenital. all everything. You just pick a specific one which is relevant to the complaint. Another is, for example, maybe the event is can be possible the congenital heart disease, so you can also ask the relevant system. Anyway, that's very rare to ask, but these are very common stations which we are discussing now. The BROI, very common, and the febrile seizure. If in history taking, febrile seizure usually come up in communication skill, but this cannot be ruled out in pediatric history. Okay, after systemic review, maybe one or two systems you choose. The most important history is here, this one. You need to ask antenatal and the birth history. Any problem during pregnancy? Was the baby delivered normally? Is all question. Developmental history, immunization. And the feeding history is very, very common and very important for the BROI. You must need to ask this question in BROI because it's very important to know maybe it's a gastroesophageal reflux disease can be ruled out, okay? And also can help you to know maybe it's the cause. So you need to know about the bottle or breastfeed you give to child because child is very young. You know, BROI is very high risk if it's less than 2 months. That's why. Okay. Next is the concern. You can skip the concern, but it's very important for the febrile seizure, but not very important for the BROI. Summarize, important for the febrile seizure, not important for the BROI. Then you will go for the past medical history. Does she any other medical condition? You need to ask, does she have taking any regular medication? Family history. The important one, another is for the BROI is a social history. This is very important for all pediatric gestation. So you need to ask, where does he or she live? Who does he or she live? And anyone who lives with Joan, smoke or drink alcohol, or you need to ask this question. So this is also very important. Then you need to close the consultation. Then you will go for the diagnosis. For example, in BROI, the differential is gastroesophageal reflux. This is very, very common. So this is very common. You need to rule out. But the child is usually greater than the 2 months, means 60 days. Management plan, the management plan is here is the first aid. Okay. For example, you need to tell, for example, maybe the child has injured himself, you need to go for it. This is similar to the all as we do for the adult, but first is very important. You need to give advice also in this case. Go for the admission if required. For example, in BROI, the high risk, you need to admit this patient and go for the investigation. For example, full blood count, ABG, these ECG, these all the investigations relevant to it. You need to go, and then you need to examination or entire examination of the baby, and also you will go for the admission under the pediatric. But if it's a low risk, then you don't need admission. You can discharge this patient with safety net. We will come up to the BROI because our next slide is on it. We will discuss how we manage BROI. Okay, so it's the same. Check the understanding of patient is clear so far. Do you have any further question, etc.? So let's sum up everything. So what is very important for the BROI? Okay, let's go back. So the important for BROI is here. First of all, you need to reassure because patient already in your research room. So reassure and then check history. Okay. So how much so far do you know about your child or maybe Jack? And then you need to ask her to elaborate more. Can you please tell me a little more about this then event? Where did this happen? What were child doing, etc. These all symptoms you need to. Was he breathing fast? Because this will help you to know is it BROI or another problem. Then system, which is relevant to it, not everything. don't need GI if not relevant, but the relevant should ask, okay? Maybe 2 or 3 questions. Then important history, this is very important history. If you do not ask this question, you will lose your entire score. Maybe you will get 2. So this is very important. Another, you can skip for Brui this ice, okay? If possible. If you have time, you can ask. If no, then just skip. Go for past medical history, drug allergy, family history, and social history. Social history is also very important because you will know what could be the cause. And then you need to close consultation and diagnosis, etc. management plan. Clear so far? Any question here?
Okay, thank you.
I'm sure that you might think maybe you need to go for ODPAR. No. You don't have to think about here is ODPAR. The reason is that, as I said, this patient is already in your RECIS. Okay? If the patient already in RECIS, then you need to reassure the parents and go for that. If patient is not in the RECIS, is didn't brought, or patient is just presented to you now, and mother said you, he has misbehaving, he has this symptoms, and now he is okay, then you don't need to go reassuring. Then you go for how can I help you? What have brought you to today here? Then you go for it. But as far I know, the station usually come up this way, as I mentioned to you. We have 2 stations, and we will practice together, and you will see that. Then you will know what approach is better. But make sure that if the patient is already brought by ambulance into the ED, then you need to go for this way. Okay? But if the patient is okay, means the patient mother brought or mother presented to you, and she said it has it, or in the history, in the case you noted the patient is not RECIS, then you go for the what have brought you. Make sure that you can change your tone. You can change the history taking away by yourself. Depends on how you got the station. Why the people usually fail, why they don't get the score highest, because they don't know how to change the station according to scenario. This is very important. So when you see the patient is brought into the ED and already in the RECIS and you resuscitate him or is going on, then you go to reassure parents and take the history. But if mother present to you now, and you don't know about it, and then you go for how can I help you, what have brought you today, then you go for etc. the question. And like febrile seizure, usually mother bring to you after seizure, and she said, I don't know what was happening my child. Okay, she said he was he has some jerky movement, etc. Maybe she can tell you. Okay, so in this case you need to elaborate more what have brought you today. Okay, so let's come up to the what station. So Brui, Alte, in other words. So the low risk we are having is if the child is greater than 60 days, born greater than 32 gestation, corrected age of greater than 45, no CPR given by trained practitioner before, less than 1 minute duration first event. So this just means low risk. So what is the treatment for the low risk, guys? According to NICE guideline.
Discharge.
Reassurance.
Reassuring.
No treatment.
Yeah, so what you will say to mother, how you will discharge, what you will say to the mother or the caregiver. You will advise on the safe sleep, okay? You will ask her, you will ask her to never shake the infant. You will also ask her to, if somebody is smoking in the, excuse me, please mute the mic. So you will ask her to eliminating the expose of the tobacco. For example, somebody smoking, you need to ask her to stop smoking. Another is you need to arrange a follow-up with GP within 48 hours. This is according to the Mrcem learning. Okay, so this guideline is given. Actually, this guideline comes from American Academy, not itself from the Royal College. but you have to follow is also you can find in our Mrcem website. So you need to educate caregiver about the brewery. So you need to say about give training about CPR, how to give, because it can possible patient may have this event again. Another, you need to ask for safe sleep. We have slide for safe sleep. I will show you the next one. Another, you need to ask her to stop quit smoking, and also the GP follow-up within 48 hours. Overall discharge with safety net. Next is high risk. One more thing is there is one investigation is giving for the low risk. I think you might have this question in a Mrcem intermediate. Do you remember what is investigation?
Yeah,
We need
ECG and
ECG and blood sugar.
Yeah, that's correct.
Blood sugar.
Yeah, ECG and the test for pertussis is bacteria, which is called the cough. So for that, we need to do just 2 investigation. I don't think so the glucose level is necessarily, but this is what is given by the American Academy, the same on the Mrcem learning. Okay, so the high risk, what we have to do for high risk, we need to admit this patient under the pediatrician. We need to do the investigation like ECG, full blood count, ABG, etc. And these all things we need to do. So overall, we need to resuscitate the food. Our fluid also need to give according to the, if we require it to give. Okay. So this is for the high risk. So overall, to admit this patient under the pediatrician. Okay, so next we are going to have is the febrile seizure. So what is the treatment for the febrile seizure, guys?
depend on the duration.
Okay, if it's a complex seizure, so what could be, what is a complex seizure means what?
More than 5 minutes.
Yeah,
More than one season within 3 minutes.
yeah, so
More than
the,
1 season or more than 15 minutes.
yeah, that's correct. So the simple seizure, we need to discharge with the safety net. So we need to advise the mother. Let's come up to first the low risk and the simple febrile seizure. So what advice we are going to give? We need to tell the mother that first of all, whenever the child starts seizing, you need to note the duration. Stop the clock, start the clock to know the timing. Number 1. Number 2, you need to put your hand around the head to support the head, or the soft blanket or the soft material around the head to help him. Another, you need to remove the harmful objects if around the child, and do not place anything in the mouth of the child. And also check the airway and place the child in recovery position once the seizure stops. So this is what we give the advice to mother. This means considered to be first aid. Another is if the seizure is more than 5 minutes, then you need to bring the child immediately to ED, or they call the ambulance. And you need to train the mother. You need to tell the mother how to give the medication. So what medication do we give if the patient is seizing, guys? Yes, the benzodiazepine, benzodiazepine, the buccal metazole, we need to tell the mother that you need to give. If not, then we need to give the diazepam rectal. So you need to tell the mother 5 mg, it depends on the age, start. And the metazole from 6 to 1 year, 6 months to 1 year, 2.5 mg. So you need to educate mother and tell the mother to give in case the seizure is more than 5 minutes. Okay, so when you discharge the patient, so you need to advise this. Okay, so all the seizure like complex or neurological deficits, all you need to admit this patient. Okay, admit patient under the pediatrician. Okay. Okay, another thing is you need to advise about the mother that this seizure, which is less than 5 minutes, cannot be happen again. But if it's happened, there is no harmful, no any serious problem like epilepsy. It's not epilepsy. It will not happen. Okay, very rare, to maybe 2%. So this is why maybe the mother can ask you in a question when you are giving management plan. So you should know about it. There is no epilepsy. Okay, there is no any harmful effect even after, if the seizure lasts in 5 minutes. But if more than that, it's likely the patient have the seizure again and within 24 hours. Okay, so clear the management plan for that, guys?
Yes, sir.
Oh, okay,
And
that's great.
if there is status epilepticus, then what to do?
Yeah, we are talking about febrile seizure. So I already said that you need to give the benzodiazepine. Okay, if the patient come up to state epilepticus, that's likely to be you will have in the ALS station. Okay, or the ALS. Okay, we will cover this one in there. Okay, I'm talking about here the history taking. Okay, so this is about the give by the lullbytrust.org.uk. So we always, sometimes, not always, some trust here, we give this advice to the parents. So this is how they avoid this all things to suffocate the baby or to further worsening the condition. Like we don't need to use the pod-out nest, COT bumpers, we don't need for the children. Okay, sleep position is very important. So we need to avoid these all things to avoid the Bray episode or the alter. Okay, so let's come up to the next slide. We have it is history taking station general approach, non-accidental injury. This is very, very complex, and sometimes you don't know what to talk, to be honest, because this station come with different ways. Anyway, so we will focus on the commonest way. Normally, when you go to read the case, they already mention the you suspect non-accidental injury. Means in the case, is everything already visible to you that you are going to take history regarding non-accidental injury. But how to start it, that's really a big matter. Okay, again, so let's, for example, the child has been brought he has, for example, I would say the bruises on his back, okay, or maybe he has a burn, but when he go to school, the teacher noticed, or maybe the child is complaining in the school about the burns. Maybe he's feeling pain or something, and the teacher or from the school, someone bring him to the ED. And when you did the examination and you took history and you did examination, you found that he has multiple bruises, he has blah, blah, and you suspect non-accidental injury, means the mother didn't present to you, but it's come from somewhere, another place. In this case, you need to reassure the mother, okay? Because mother maybe come to you later, even mother came to you and present you child, and you took the history, everything, but when you did examine, you did x-ray, you found the x-ray is this, and then you need to go to talk to mother. So in Mrcem, they usually give this case like this. For example, they will say a 4-year-old child brought into ED by mother, and you suspect non-accidental injury. His X-ray shows like the broken humerus, the humerus fracture, and he has multiple bruises. Now go to talk with mother. Please talk to mother and explain the management plan. So what it shows you, that shows you the patient already in the ED, you already saw, or your colleague saw. Maybe it will mention your colleague did X-ray, okay? Because the X-ray is done already. So that means you need to go to the mother, Maybe mother will say, where is my child? Maybe mother will say, you will go to introduce mother, and you will go just to reassure the mother that child in with our team, he's safe, you can see him soon, but I need to ask you some question, I need to collect some data from you. Okay, and then you say, how much so far do you know about Jack's condition? Maybe she will say, oh, my child has a sore throat. Or maybe she will say, my child has a tummy pain and I brought him here, and that's why I came here. Blah, blah, she will explain to you. And then, but what you have to do, so let's come up to first important thing. In Mrcem, when you come up to this station, what happens usually? You read the case notes, 1 minute done, the bell is ringing, you come inside. When you come inside, there is examiner, he will give you the notes. There will be 2 notes. One will show you the x-ray, another is the brief history. Okay, so when you read the notes and also to see the history, and you found that this child has a broken arm or etc., and it's clearly show you non-accidental injury, right? That means the patient has been seen. So you need to start your introduction, etc. Then you go for how much so far do you know? The same like as I said about the BROI. And then you will go for like if the child came from the school, then you will say, oh, the Jake is brought to the ED by his teacher, by the school, the worker, maybe. So you can say like that, and he was crying. We gave him painkiller. On examination, we found bruise, burn, etc. Could you please tell me how did this happen? Means this is you go for elaboration. This is I'm talking about the if the child is brought from the outside, but if the mother brought it, so you can go for again the same this way, that we found that our colleague, if the colleague did x-ray, say yes, our colleague finds there is a broken arm of the Jake, or you can there is a fracture. Could you please tell me how did this happen? So you need to settle down your tone according to history, according to the case. If the outsider, you need to reassure and you need to start this way. But if the mother brought it, in this case also, if she come up to you and she said, where is my child, or etc., you need to reassure again, and you need to start this way that, okay, my colleague did x-ray. First of all, you know how much so far do you know about your child? She will say blah, blah, and then you say, okay, I'm sorry to say that I have my colleague did x-ray and it shows the broken arm of your child. Could you please tell me how did this happen? You don't need to go for odipara. Even the sore throat, she said, you don't need to go because this is diversion. Everything is, you can start from your notes, which notes is given to you inside in the station, the x-ray. You need to start with that. You don't just skip the sore throat because this is a non-accidental injury. So that's just a misleading information. So you just say, my colleague did x-ray in unfortunately, I'm sorry to say that there is a broken arm. If you don't mind, could you please tell me how did this happen? And then she will start it. Maybe she will say, I don't know. Okay. Anyway, she said, don't know or what else. So, but you need to say, okay, Miss Oliver, I need to ask you some question. Is that okay? Okay. So how's this, if the burn, if the fracture, how's this happen? How this arm fracture? He has mark on his legs, maybe bruising. So you need to ask who was present at the time. Maybe she said, yes, he yesterday fall down. Maybe you need to ask her who was with him in that time, any witness. What was done about the burn fracture? Because this is a very important question, because this will give you idea that did she seek a medical help or not? If not, that's mean neglection, okay? Maybe she neglect her child. So this is also help you in this case in management plan to whether you involve the social service or not. Did you seek medical help? Okay, if she said no, then reason for not seeking medical attention. These are very important questions for this station. Okay. Another, here don't need systemic review. These are not relevant here. Then you will go for the social history. Where does or he live? Whom does he live with? So you need to ask this all question. Then you go for the birth history or antenatal, and then developmental and immunization. So this half slide which I'm showing you right now, this is very important for especially for the non-accidental injury. So this can help you to whether it's a non-accidental injury or not, and how the patient is information is true. Because the patient can tell you wrong information, they can mislead you, maybe they can divert you to another, but you need to stick with the history taking this way. Okay, so it's clear so far. Any complex things here you are suspecting or you are feeling?
No.
So did you understand two things? You can have two kind of scenario. One, either the child brought from the school or from another place. Another is maybe the mother brought you already and your colleague did x-ray and you found, or maybe you did x-ray. Maybe they will say you suspect the NAI and you did x-ray, show broken bone. Now you will go to mother and you will talk to her. You will first introduce yourself, okay? Then you will go for the history. But here, don't need to ask like, how can I help you? What have you brought you today here? Is not relevant. The relevant thing, you need to start with the introduction, then you know how much so far do you know, because maybe the child is already here, okay? So you start this way, and then you go for the directly go to the non-accidental history taking approach. So you need to ask her, like, I need to ask you some question, or you can go with this way, like, my colleague did x-ray. Unfortunately, I'm sorry to say that it shows that there is a fracture. So could you please tell me how did this happen? When did this happen? Okay. So if she said, yes, he fall down, etc. Okay, who was with him? Okay. So you need to ask this all question. Okay, so this is about this one. And now let's move to the past medical history, the same way, drug allergy. But what difficult situation you will face here? When this station come to you, the Mrcem also focus on few other things, for example, not about the data collection, but they also look at your behavior to patient. Maybe patient, when you come up to the patient that you are going to involve the social services, okay? When you're going to involve the social services, because you can see that any enrollment of social service recently and previously, sorry, because previously is very important. Okay, so when you come up to this social service, when you found that this is a non-accidental injury, so you will admit the patient, right? When you admit the patient, you will tell her that you will enroll the social service. Maybe she will get angry. Maybe she will be aggressive. But what you have to do, you need to, few things you need to do. Number one, you need to keep your tone down. Okay? First of all, for example, you will say, I can understand you feel that way. I apologize. I'm sorry to hear that. So you could support her and tell her, but you make sure that you would say, is in the best interest of your child and safety, we need to involve these social services. Very important is we are not finding what has happened to your child, how this injury happened to your child. So there are different ways of communication. The Mrcem test you here not about how you communicate overall, but they check your tone. So low down your tone, number one. Number two, you don't sit down on the chair like cross legs or the cross arm. You need to sit normally as a professional way, because this is very important also in case in the behavior or the communication skills with the patient. Another thing is you have to do, like, you need to acknowledge the patient. Like, you need to tell her that you are looking very upset by all this. I can understand you're in a difficult situation, but it's very important, in the best interest of your child and safety, we need to involve the social services, and that's what we are doing here, because we don't have the clear information that how this injury happened to your child and how these bruises or multiple bruises to Jack. So in this case, you need to verbalize like this way. And then you need to ask her, if still she is that, then you need to ask her, could you please tell me why you are feeling that way? Maybe she can tell you, maybe she can give you some hidden information. Okay. So in this way, you need to know the reason why she is aggressive. Then you need to say her that, okay, it's totally empathy, what we say. You need to say, it's totally understandable you feel that way. Or you can say, it sounds like you have a lot of going on at the moment, and it's natural that you are feeling angry or you are feeling that way. But in the best interest of your child and your safety of your child, we need to involve the social services. Very less likely the mother will be aggressive, but it can be aggressive. Maybe the important thing is you don't need to be aggressive. You need to be supportive, and you need to follow the guideline and the communication skills. Multiple ways of communication skills, not exactly you follow me. You should be natural. Just need to stay calm and support her as much as you can. Okay? It's not necessarily you must find these sentences and you should say it. No, not necessary. They want to test you how you behave to the patient. If she's aggressive, will you be aggressive or not? You don't have to be aggressive, okay? So in this case, they will test you also this one. So because when you will have by chart will indicate you history taking, gathering information. They will also mention that communication skill, maybe 20%, clinical decision reasoning, maybe 20%. So we have the station and you will see. So this is very important station and very complex to start it, because you don't know how the patient presents to you. Overall, the good way start, reassurance, and go to the point of the history taking. Don't waste your time in IDPARA. Don't need to go for all these things. Directly get into the station. You will get notes, introduce yourself, reassurance, and start the station. Clear?
I have one question here.
Yeah.
For example, if the mother or the carrier it refused the admission or whatever that needed for the patient because he suspected non-accidental injury, and she insisted to take the child home, how can I will deal with this situation?
Yeah, this what I said just now. But another, okay, I continue this one. You say the management plan. Let me finish this one first, okay? If you still have question, I will come up to that. Management plan in non-accidental injury is come up to what step you, for example, he injured himself. I would say the first aid, the painkiller you will give to the patient, number one. Number two, you will apply if there is bleeding, you need to stop, or if required back slap, you need to apply the back slap to the patient. Okay, this is the first aid. So usually, mostly we give the painkiller and then go for further investigation. All things will be done by the pediatrician, social services. All things will be done. But the emergency treatment must be given, like painkiller or the back slap if required, if a fracture. Okay, then when you explain this one, for example, you said the information I collected from you, Miss Oliver, this is what I'm going to do. I'm going to admit your child under the pediatrician. The pediatrician will do some tests. So the examination of your child from tip to toe, okay, from top to toe, entire. It will include, if the fracture, you will mention that skeletal survey, okay, full blood count, okay, this all. But for after examination, the investigate full blood count, skeletal survey, and also we will also give the painkiller to your child because he's in pain, okay, or we already given. And what I am going to do next is I'm really very concerned about his injury, which is fracture, which is not very common in this age. Okay, so what I'm going to do, I'm going to enroll our senior member, or you can say the consultant of our department, and also the social services, is the best. It would be the best interest in the safety of your child, as we are not as the injury is unknown to us right now. The information you gave is not relevant at all. You can say like that. So you need to be very careful when you pick up the words, because you need to avoid the accusing or the blaming or the mother, okay? Because because you are suspecting, right? It's not confirmed. Make sure that when you're communicating with the patient, you likely say, likely possibles. You are suspecting. You don't need to show like that you're 100% true, because you are going to get yourself in trouble if maybe it's not non-accidental, maybe it's not non-accidental, maybe it's really happened due to another reason. When they are investigating, they will know it, because you're not going to communicate with the child, but you're communicating with the mother. If the child didn't open up, didn't tell you that what his mother did to him, so of course you will suspect. You're not sure until you go for the investigation. And then you need to be very supportive. Even mother, I write down already here down. So patient's mother, relative may be aggressive or angry. You should be supportive, empathetic. Okay, so you can say I'll just now say, it sounds like you have a lot of going on at the moment, and it's natural that you are feeling that angry or you are feeling that way. But what step we are taking? We are taking the best interest and safety of your child. Okay, so our senior will be involved, and social service to involved to go for the investigation further, that what has caused this fracture or the multiple bruises to your child. So this way you can communicate with the mother of child. Clear? Do you still have this question? I don't know who was the. Excuse me?
Yeah, thank you. It is clear, doctor. Yeah.
It's clear, right? So remember,
Yeah.
when you come up to you say, based on your information, I suspect, or the most likely your child has this one. So what I'm going to take the step, I'm going to admit your child, and then pediatric they will do, because this pediatrician will do, like he will go for the investigation, he will go for the skeletal service if required. Okay, and then you also say, well, I will give him the painkiller, because of course, if the patient is a pain, you will need to give the painkiller. And if fracture, you also need to involve the orthopedic. Overall, the pediatrician will involve it, but you need to mention. Then you will go for the concern. So your concern should be come up after that, after the first aid. So you will say, I'm very concerned about this injury, fracture. So I'm going to, it's not very common in this age, so I'm going to involve our senior consultant of our department, and also the social service. So when you come up to the social service, maybe the mother gets angry. Overall, you need to be supportive, and all steps should be taken in the best interest of the child. Okay, I know it's a little bit complex for you and really a little bit headache for you. Anyway, you will come up this one. Okay, child abuse and non-accidental injury. I write down what could be. So bruise over the knee shins is considered to be normal finding. So if the bruises in the case is given like bruises or knee and shin, so you don't need to suspect, okay? But it's less likely. If non-accidental injury, there must be a non-accidental injury case. So following features suggest a non-accidental injury, like bruise over medial aspect. I think so. You have got this question in intermediate too. Bruise in non-mobile babies. These all things you need to read out when in your free time. And the fracture, ribs and spinal fracture. But remember, distal tibial fracture and also the supracondylar fracture are not non-accidental. Okay, clear so far? Supracondylar fracture and the distal tibial, what we say spiral fracture, are not a non-accidental. Okay, clear? So it's not be considered as a non-accidental injury. So other long bone fracture like hemorrhage, femoris radius, or in children less than 3 years, Salter-Harris type 1, type 3, this is according to NICE guideline. Suspects non-accidental intracranial thermal is a burn. Okay. Following indicate force immersion, scalp, perineum, lower limb, etc. Okay, so this is very important slide relevant to your history taking. So ensuring access to appropriate medical care or treatment. So consider neglect, as I said, if the parents' cares fail to administer essential treatment for their child. Consider neglect if the parents or carer repeatedly fail to bring their child to follow-up. Consider neglect if the parents or the carer persistently fail to engage a relevant child health promotion program, like immunization, health and development, and also avoid seeking the medical help, as I said in previously. So when you take history, you will know it. So when you will ask a patient, did you went to the hospital to treat your child when he burned himself? Or did you seek medical help? Or did you seek medical attention for your child when he burned himself? Or when this fracture happened? If no, then you need to, any reason why you didn't do that? So if she said, make excuses, that means she neglected her child. So you also need to involve the social services. Okay, so now we are here. The bronchiolitis, croup, hypertrophy. These two stations are very, very common, bronchiolitis and pyloric stenosis. Recently in 2022, it came twice. So it came twice in 2022. So this is that's indicate the common state. Also before in 2022 also came up twice. So that's indicate it's very common station, bronchiolitis and also pyloric stenosis. Okay, so this approach is similar to Edipara. It's the same. Just the difference is that you need to take the birth history and antenatal. This is very important. And the other relevant systems you also need to take. So important history, the developmental, immunization, IC need to go summarize, and social history. This is very important, also need to take from the mother. So I think it's very easy and it's very common. Differential diagnosis, you have to go for it. I forgot one thing. So could you please tell me, if you suspect non-accidental injury, what will you do? You will involve pediatrician, your senior consultant, you need to involve social services, okay? But don't forget, you need to give first aid first. Okay? Okay. Let's come up to the important stations. First is bronchiolitis. The children, if the mother brought it, it would be under 2 years, but it's very, very common, 3 and 6 month age. Child will be present with a persistent cough, a tachypnea, chest research. So what is the treatment for the bronchiolitis, guys?
Supportive treatment. Oxygen and
oxygen.
hydrofluid.
Okay.
Suction.
Okay. So how you will say when you need to admit, when you need to discharge? How?
Symptomatic treatment.
Yeah. I understand symptomatic treatment, but in some cases you need to admit this child.
If there is poor feeding in the child,
Number of ordinary.
If despite oxygen therapy, his oxygen saturation is below 92%.
Yeah. Now let's come up 3 important points I want to tell you. In this case, you need to admit this child. Number 1, persistent O2 saturation less than 90%, child age 6 weeks or over. Okay. Less than 90% in 6 weeks or over. If the baby is if baby is under 6 weeks, then 92%. If the saturation is less than 92% and the baby is under 6 weeks, then you need to admit this child. Another is the insufficient intake of the food, 50 to 75%. Okay, the last one is the respiratory rate is greater than 70 breaths per minute, or the chest recession. In this case, you need to admit this child. Clear?
Yes, sir.
clear, yeah.
Yes, sir.
Yes.
And when you admit, so now you need to verbalize this in management plane. If you have time, you need to verbalize to mother, if I found these features, if I found your child's saturation is not improving, is less than this, I will admit your child, and I will pass a tube from his nose to his stomach to help him to get the food. Okay, because this child needed. Okay, another, you will say, yeah, this is very important. If this NG tubes doesn't help, then you will say, I will give the fluid with the throat vein. Okay. Okay, so all is situation like you need to discharge this patient. You will not give the antibiotic, just support him, and you will say to mother that this symptoms will resolve by itself through sometimes. Okay, so you can discharge this patient with ceftonate, but you need to tell her if the patient condition is worsening, like if the patient is breathing from his abdomen, like you find the patient condition worsening, you can come back to the ED. Okay.
Okay.
Okay, now let's come up to the CROP. So what is the treatment for the CROP, guys? When you need to discharge, when you need to admit the child in CROP?
We will do the basic score, and if it is more than 6 centimeters severe, then we will admit, otherwise we will discharge. And with the treatment to be given, if it is mild, then we will give per oral dexamethasone. If it's moderate, then we will give nebulize him with medicinate, and then we will also nebulize him with adrenaline 1,000.
Okay, good. So I want to tell you the what you have to say. Based on your information, you gave me the most likely problem your child has the condition called CROP in medical term. What I'm going to do, I will keep in observation room. I will do the examination of his chest. Okay, and I will do some blood test, blah blah. Okay, and I will use a screening tool called Wesley score. If your child's score is 2 or less than 2, I will discharge your child with ceftonate. I will give him single dose of one medication called Dexa immediately now, and I will discharge him with the ceftonate, which includes, you need to use the paracetamol or brufen to control his fever. Okay. In case the child condition is worse, and you can come back to the ED. This is about the mild. if your child's score is the 3 to 5, means moderate, just verbalize moderate to severe or impending failure, I will admit your child here. Okay, I will give him the oxygen. I will give him medication through inhaler, the medication called budesonide. Okay, so to help him to in his condition or his health, like this way you need to verbalize. Okay, and if once your child get better, we will discharge him. So this is the management plan. So the score, the miles is 2 or less than 2, you destroy this patient. You need to mention that you will use a screening tool. That's very important. Because I remember one guy, he gave the exam in 2022, and he has this station. He didn't follow the score. So examiner asked him at the end, could you please tell me what score, or do we use any screening tool? And he didn't respond to him. Okay, so because the management plan depends on the screening tool. Because if the score is 2 or less than 2, you need to discharge, right? You don't need to admit without any reason. And when you're discharging, you need to give the single dose of the DEXA, 0.14 mg per kg. Clear? So you need to say that this, you need to verbalize, because if you want to get a good score, you need to go this way. Clear? Guys,
Yes.
are you okay?
Yes, sir. Yes. So dose for the DEXA is, I think, 0.15 to 0.6, right?
Yeah, 0.15 mg per kg, you need to give immediately. That's correct. Okay, this is according to the NICE guideline. So why I'm following, because I want you should be get use of it when you come up to the practice, in especially in this developed world, even in Australia. So you need to follow the guideline, not the just like you follow in your country. Maybe it doesn't work. Okay, so let's come up to next one, pyloric stenosis. So the common in 3 to 6 weeks. From case notes, which will be on the door, you will understand most of the station you can recognize from the case notes on the door. Maybe if you are good enough intelligent, maybe you can get everything from the case notes. Seriously, I'm not joking. Maybe you can get it from the case note. You can understand it's likely be pyloric stenosis. But the problem is that people don't get the score. Either they don't collect the information nicely, or either they forget to give the treatment plan correctly. So that's why they lose their score. Anyway, so what is the treatment for the pyloric stenosis, guys?
Pyloromyotomy.
Okay, why you should go directly on it before what step you will take it, because emergency treatment first, then referral. Okay.
The fluid and electrolyte balance first.
Fluid and
Correct dehydration, fluid and electrolyte balance, and then admission under surgical for pyloromyotomy.
That's correct. So always I say the management plan follow this way. You tell the patient likely the cause. Okay, you say based on your information, the most likely problem, how you will say in your word. What you will say pyloric stenosis, or you will simplify it further to mother.
According to the data given by you, there is most likely possibilities there is narrowing of the outflow of your stomach going into your small intestine. There is narrowing, and your the stomach contents are not emptying fully, and that is the reason of his repeated vomiting. So that is why we will do some operation and cutting the muscles of the stomach outlet, so that
okay.
his stomach can get empty early.
Two things you need to be simplified for the mother. Number one is the pyloric stenosis word. This is a medical term, so that's very good. You say the narrowing passage from the stomach to intestine. Okay, so you will say that your baby has a problem. There is a problem in your baby's stomach from the place to connect with the intestine. It's narrow. The passage is narrow. That's why he is vomiting frequently. So what I'm going to do, I'm going to admit him here first. Okay, I will do the examination of your baby. Okay, I will do some investigation, some tests, including the ultrasound. Okay, you will say the tummy scan, and I will give your child fluid through his vein. After that, I will involve the surgeon, okay, surgery doctor, because your child require to fix this narrow passage, to remove this extra tissue if it's there. So this procedure called pyloromyotomy. So you can explain this way. Simplified more. Maybe the mother will ask you a question. Is there no any other way like medical treatment? So what you will answer? If she say to you, is there any way just a medical treatment, don't need the surgery? What you will say?
There is no medical treatment available for this condition.
Yeah,
Only
yeah, just support and reassure her. There is nothing to worry, and there is no any treatment medical. That's why we are going for this step, and success is very high rate. Just maybe she's worrying about that. Okay, so in other is we are having HSP. We already discussed previously. So what is the treatment for HSP if a child present to you? Yeah, this disease is usually self-limiting. Okay, you need to reassure mother this is self-limiting, and you will give the painkiller to. Why do you give painkiller, guys?
Arthritis, because he has arthritis.
Yeah, yes, joint pain is very, very common in HSP. So you need to give him or her the painkiller, and these also the counseling to mother that is a self-limited condition. But you need to warn that bed rest also included, but you need to warn in case of the kidney involvement, we will involve the kidney doctor for the treatment. But it's very rare. You will not have this complicated cases anyway. Okay, so this is also limping. Limping is very common too. So the commonest state, what do you think? Which can be very, very common in your opinion, guys? What do you think? Which from limping, which station is very common? What do you think?
transient synovitis.
Yes, that's correct. The transient synovitis is a very common station, and it's very simple and straightforward. The station, you don't have to miss your score. Okay, so limping, the same approach you need to follow. Okay, so let's come up to fracture or soft tissue injury. So age less than 3 years, very common, will be present point tenderness. So fracture always have the tenderness over local area, right? Redness, bruising, etc. So total fracture. So what is the treatment for the total or the spiral fracture? Is it non-accidental injury or not?
Cast.
Yeah, is it non-accidental injury, guys? Total fracture.
Accident.
No. In toddler, it's not.
Yeah, it's not. Okay, that's good. Very good. So it's not a non-accident. So what you have to do, you need to, what you will do, guys, you will give the painkiller and apply the back slap, okay? And very important to arrange a follow-up with orthopedic. This is your job to do. Okay, this is very simple. How about the sprain and strain? This, what you will do, what is the treatment?
Pain management and
Ice?
immobilizing.
Yeah, someone said just now, I heard the lady's voice.
Prices.
Yes, sir, ice.
Yeah, so we say price, okay? The NICE guideline put very nice, how to say, the mnemonics price. That means protection first. So so you will ask the patient to apply the high top, or can lace up the shoes, the place, okay, to protect it for the injury, or apply high top. Another is rest, avoid activities for 48 to 72 hours. Another is ice packing, wrap the ice in the towel and apply 3 to 5 minutes. When you explain this to the patient, like price, or you need to apply, he will not understand it, right? You need to simplify it. So what I say, always say, when you give the information to the patient or the patient carer, try to give information, small pieces that the patient can swallow it, or they get information very clearly. Okay, so ice should be wrapped in a damp towel or anything. He needs to apply after 2 to 3 hours. The compression, especially elastic bandage, but should be avoided when patient go to the bed. Okay, so in this case, he needs to avoid this the compression. Okay. Next is elevation. You need to put the pillow below under his knee, or under his foot, or under his leg. Okay, let's come up to transient synovitis. Okay, so anybody can tell me what is the treatment for transient synovitis? 3 things very important. Child will be afebrile. Okay, maybe child have maybe little pain. Okay, children are usually have the upper respiratory tract infection or viral illness usually. So this can help you. What is the similar to transient synovitis? Usually differential, we put it. Which one?
Septic arthritis.
Yes, very good. Septic arthritis. So we use a special criteria. Do you know what criteria we use it?
Coccus criteria 2, in which walk tube. The patient will be unable to walk. They will be fever more than 35 degrees Celsius, raised WBC and ESR more than 40.
Yeah, that's correct. So we have the Cocker criteria. So we use that. This mnemonics is walk few. That's correct. Okay, so but for transient synovitis, you already know it. The patient doesn't have fever, and he gives you the viral illness. Don't go for Cocker criteria. Just skip it. Okay, don't need to even mention, because it's give you idea that this is transient synovitis. Okay, don't waste it. But if the patient came up to septic arthritis, in this case, go for Cocker criteria. Okay. So what is the treatment?
Painkillers.
Reassurance and painkiller paracetamol.
They will need analgesia, proper analgesia, and bed rest for at least 7 to 10 days. And would advise them not to be awake in this time.
Yeah, that's correct. So first of all, you need to tell the mother that it's a self-limiting condition, right? So just need to wait for it will heal on its own, and give the analgesia, and avoid some dangerous activities or sport for temporary. Okay, that's good. So next is we have the Pert's disease. Okay, so Pert's disease, usually it's idiopathic avascular necrosis, and the child typically present with limitation, hip rotation. Okay, everything right here, ready? So what is the treatment for that? And a very important thing you need to notice, look, this is very common in 3 to 6 year age, right? Transient synovitis, and the Pert disease 3 to 12 years. And this can also give you idea, okay? So what is the treatment for that, guys?
orthopedic referral.
Surgical treatment, so we need to refer the patient to the orthopedics department.
You will directly go for surgical treatment, or first you will discharge this patient with the safety net?
Discharge a patient.
If the patient first time present to you, you can give the parents two kind of things. You will say it depends on how severe the case, how the disease is. If normally what we do, we give the symptomatic treatment like ibuprofen we give, okay, painkiller, and advise restriction of the activities. We will ask the mother to ask the child, do not do some activities which are high impact sports like the running, okay, avoid running, okay, jumping or this kind of sports should be avoided. But he can swim, encourage him to swim. This is what is the guideline side. So we also do that. Another is it maybe some children require cast, some maybe doesn't require. So it all depends on how severe the case. But we must arrange a follow-up with orthopedic. Clear? So what you have to say is based on your information, the most likely problem is the Perth disease. But if you are the confusing on the disease, so you can also add the SOFI as a differential. So you can say, I'm going to do the examination of the child. So what does the examination include, guys, in limping child? Could you please tell me what examination you will do?
Hip examination.
3 important things.
Inspection.
Look.
Gait.
Look.
Gait.
Feel.
And move.
Look, feel, move. Must mention in the management plan. I will examine your child, which include look, feel, and move. In move, you will check the gaits, right? Okay, otherwise your examination is incomplete. Means you didn't mention at all about the examining. Then you will say, I will do investigation, I will do the x-ray. If it's confirmed the Perth disease, okay, and if it's not severe, maybe I will give him the painkiller and I will discharge your child with safety net or with advice, which include he needs to avoid high impact sports like running, but he can go swimming if he wants, okay? And he needs some rest, proper rest. And I will also arrange a follow-up with the orthopedic. But if I found this is severe case, it's totally necrosis, of course, she will not understand this one, but you just mentioned if in severe case, if I found on x-ray is dangerous case or severe case, I will refer your child to the orthopedic. That's require surgical intervention. Clear?
Clear.
Yes, clear.
Because you know that it can be it can be Perth disease, can be SOFI, so you can get a lot of confusion, everything together. But as I know that I never heard that this station ever come up. Transient synovitis is very common station, but you don't need to rule out this one. In case it's come to you, so you need to be ready for it. First of all, this patient can be destroyed, depends on severity, okay? But you must arrange the follow-up with the orthopedic. So you need to say, okay, let's come up to Sophie. So, okay, so this is very common in 10 to 15 years age. So what is the treatment for that, guys?
Internal fixation.
Okay. This is very urgent, need internal fixation. But until internal fixation not done, what he has to do?
We have to tell them that I will do X-ray, and on seeing the X-ray, I will do the Prithovian sign by drawing a line of plane. If the epiphysis is moved, then it means that this is SUSI. We have to explain this to the patient like this.
Okay, let's come up to, first of all, you need to mention the X-ray. X-ray, we do frog leg view X-ray, right? Lateral view X-ray. So you will do, and then you say if it's confirmed, slip upper the surface. So what I'm going to do is your child require urgent surgical intervention till it's not corrected. The advice you need to give till it's not corrected, your child doesn't need to stand up. Okay. So avoid the placing weight on that side. If it's a one side leg, for example, left side. So you need to mention, because if it's doing is further worse conditions, it's very important to mention to this child these things to mother. Okay. So this is always need surgical intervention. And for that, you need to refer to orthopedic. Okay, so last one we have the before last one, sorry, septic arthritis. Okay, so what is the management plan for that?
Here we will describe the cautious criteria.
Okay, if it's confirmed that it's a septic arthritis, then
Needs admission.
Antibiotics.
very good. You need to admit this patient urgently. Okay, immediate admission. Number one, analgesia, antibiotics. Okay. And need a surgical procedure. What surgical procedure you will do? You will not do, but the orthopedic will do. What you will do?
Joint aspiration.
Wash the
Yeah,
joint.
wash. Yeah, that's correct. Wash. Very good. So if you can do it, so it depends on where it's located. So you can also do. So wash the infected joint. Okay. So wash out. So this is very important. Okay, good. Excellent, guys. So osteomyelitis. Okay. So what is the treatment for that? Very simple. Analgesia. Okay. And also control the temperature and also antibiotic for that. But it doesn't require the washout procedure. The last one we have the this one, Osce. So what is the treatment for that, guys?
Bed rest.
Analgesia.
Analgesia. Yeah, analgesia, ice pack. Okay. And avoid kneeling.
Avoid exercise.
Use protective knee pad if he is doing kneeling, and other is the sport activities for some times until it's get heal. Okay, and it can be take few months even though. Clear. So this is not very common. Just so you know it. Okay, guys. So finally we finish up this all. I think there's a lot of to swallow, right? I'm sure you must have a lot of confusion regarding the history taking in different places. Anyway, the practice will make you perfect. So we're going to have the break for 5 to 10 minutes. And before I'm going to go break, I want to a little bit focus on this to show you the case notes. Okay, let's come up to the case notes. So you can see this chart by chart, and this 20%, 20%, 50%. So this divided in 3 parts. They are testing you here also the communication skills with the mother. So Jake is 5-year-old who has been brought to the ED school because he had been crying with the back pain. You already examined him and found a mark on his back, which looks burnt from iron. He also had some lean bruising on the back of both his thigh. Okay. He is too upset to tell you how got them. His mother has just arrived and being found by the schools. Okay. So what do you think? What station is it?
Non-accidental injury.
Non-accidental injury. It can come up this way. It can come up many ways. Other also can come up to you. Not only this way. Another, I show you this station. Look at this one. What do you think? What could be? She is unwell, her sore throat, you suspect NI, and because child has multiple bruises, her X-ray will break in. What do you think? And you will get this notes inside in the station. As I told you, when you will come inside in the station, the examiner will give you this notes. Sometimes you don't need to verbalize. Is there notes? Is there anything else? No, you don't need to verbalize. They will give you by themselves. Okay. Of course, if they don't give you, how you will go for the station? You cannot run the station, right? So they will give you in your hand, just when you come in, and the examiner will give you this. So this is also NI, but in different ways. Okay, so the next station, what do you think? What could be this one? Seizure is self-terminated. He is now settled, sleeping in the COT. What do you think?
Febrile seizure.
Febrile seizure, right? It can come up to different ways too. Okay, so this is look. This is mentioned 2 months. Okay, so it's also give you a sleep mother. I don't think so. The station will exactly come up like this way. It can become up different ways, but the overall the pattern, or I mean you will face is the case notes a little bit similar. Means it can be like on the Bury LT will be like that. It's 2 month age, will be young patient, mother will brought it to. I'm talking about here the mother notice. Maybe they will not mention you exactly the mother notice this is, okay? Maybe they will mention something another. This mother found, okay, maybe they can say the mother brought a child. She was walking in the park and found the child, something wrong with child. Or maybe they will also mention you another way, like misbehaving, okay, misbehaving, or maybe when you explore, maybe they will say she went cyanosis, she went dizzy, she stopped breathing, she was breathing fast, she was floppy. She will say when you take the history. So it can come up very different ways. So you just be ready. This station can be. Another station, we are having a limping child. Okay, so limping child is also, as I said, the transient synovitis is a very, very common. Next station, we have the cough. Cough can be croup, can be bronchiolitis, but you can rule out simply with this way. Like this is a 4-month-old, so 3 to 6 month, very common is the bronchiolitis. Okay, so another station we have the vomiting, and you can see 1-month-old. It means neonate, right? So this also indicate what could be. So don't worry. Yeah. So don't worry. What is the problem? Usually you can understand the station from the case note. Mostly station or visible from the case note what they want to know about you. The problem is that you don't know how to give the management plan. You don't know how to approach the patient. This could be the serious problem. Otherwise, the station are straightforward, not really very difficult to understand. Okay, so always check the age of the which is mentioned in the case, especially in pediatric. Pediatric history always based on the age. One point can come up from the age. Rest of things you can find other points too, but age is very important in pediatric. So they can help you to what could be. So this is very important. I don't know. Please close the there is someone who. Okay. Okay, guys, let's have a 10 minutes break. We will come up with the role play, and you need to be ready for it. Okay?
I have a
Dr. B,
question.
I
Can
have
ask
one
it now
question.
or after the break?
Excuse me, one by one, please. Yeah. Who has a question?
Yes, I have one question. Transit synovitis, how we will explain in a simple language to the mother?
You because this
Mechanism
you cannot,
and what is happening.
you know, first of all, the history, when you will ask any recent history, maybe she will tell you he has a sore throat or etc. The management plan, like I don't have any simple word for transient synovitis, but you can say it's a self-limited condition. It will heal its own. Okay. In medical term, this condition called transient synovitis, because it cannot be broken down into simple words, right? So that's why. Okay, because okay.
Sometimes it's called irritable hip or something like that.
Or you can say it's a simple inflammation in his hip joint. You can say like that. Okay. Inflammation in his hip joint or in his joint, you can say like that. Okay. If you want to make it simplified further, you can say the most likely problem, there is inflammation on his joint, which is called in medical term the transient synovitis. Okay. You can make like this way, and it's a self-limiting condition. You can aid the things. Sometimes you can use this word inflammation, which is called infection or inflammation. You can do. Okay. Any other question, guys?
Yes, I do. For these scenarios like the Sufi and the Purse disease, so the diagnosis will be confirmed usually by the X-ray.
Yeah, that's correct.
In the station, if it comes as a station, as a history-taking station, how would I say to the mother that I'm suspecting whether Sufi or Purse disease or without an X-ray?
Yeah, you don't need to. You can say that the most likely problem in his hip joint, it can be the slipping of the bone, or maybe the top of the bone is slipped, or maybe is damaged, or in other words, you can say. So what I'm going to, because you need to put one in differential, okay? One is differential, one is suspecting, because both condition can be possible. So this all depends on the X-ray. So you will say like that, based on your information, the most likely problem I am suspecting, maybe there is a slip of the top of the bone or the hip bone, maybe is slipped, or maybe is damaged. Okay. You can simplify damage, or maybe there is any inflammation. So what I'm going to do, I'm going to keep your child observation. I will do the examination, look, feel, and move. Okay, you will mention these 3 words, must mention, and I will do some investigation, which include the X-ray. If X-ray confirm this, the bone is slipped, that means this is the diagnosis called slip upper. So in this case, I will refer him to urgently to the orthopedic, because this needs surgical fixation. You need to mention like that. But if the avascular necrosis, in this case, you need to say there are 2 ways. If it's not severe, I will destroy with the painkiller, okay? And he needs to avoid some other activities, okay? And also I will arrange the follow-up with the orthopedic, because it depends, all depends how severe is this case. Clear?
Yeah, all right, it's clear. Thank you.
Yeah, because these 2 both can be possible. You are not sure, right? But
yeah, exactly.
Another way is that the age. You can differentiate a little bit with the age, but it's very hard to do that. So you need to mention both, or either you mention both, or you can put one in differential. Clear? Okay. Clear. Any other, guys? Any other?
Yeah.
Okay.
Okay. Hello.
So many questions. We will come up in the end of the session. Okay.
Okay. Thank you.
Okay. Yeah. I will give you time, maybe 20 minutes, to ask any question in the end. So I will answer to everyone. Okay. Okay. Let's see you in 10 minutes. Let me know if you are enjoying the music. Can you listen to music? Is the sound is okay?
Yes.
Okay, that's good. Okay, see you in 10, guys. Okay, so who want to start first?
I'd like to go.
Me?
Okay, Tasnim, right?
Yes.
Tasnim.
Yes.
Okay,
Yes.
Okay, Tasnim. Okay, Tasnim first. Okay.
Okay. Hello. Hello. I'm Dr. Tasneem, ED registrar. May I know your name and relation to the patient?
Yeah, I'm a labor. I'm the mother of child.
Who?
I'm the mother of child.
Okay. Nice to meet you. Okay. Your child Jack now in our in good hand. Okay. He's in our with our team, and you can see him soon. Okay. I need to know how much you know so far about his condition.
Yeah, the school called me today and they told me they took him to my son to the hospital, and I'm really worried where is he now. I want to meet him.
Yes, okay, don't worry. Okay, like I told you, the school brought him to ED today. He complaining from back pain. Okay, and after examination, there is a burn in inner thigh. Okay, we already start treatment for that.
Okay.
That okay with you?
Okay.
Okay, please can you tell me how did that happen to the Jack?
Oh yeah, the 2 days. Sorry, yesterday, the Jake stepsister, she did ironing, and she told me his fall down on his back. I just knew about it, and I talked to his father too, which is not with me, and he said it's okay, he can go to school, and it's not serious.
Okay. You told me that happened yesterday.
Mm-hmm.
Okay. And you told me his sister saw that.
Yeah, his sister do ironing, and the ironing fall down. And
Yes, iron just fall down in his back and his inner thigh.
yeah.
Okay. Did you do anything, visit any hospital to seek medical help for that?
No hospital. I quickly wash him with the cold water. I apply cold water and make him comfortable. And I said that I showed his father, and he said it's okay, it's not serious. So I didn't go to hospital, and he come to school.
Okay, that's okay. Can you tell me who live with him at the home?
I live with him, and he has one stepsister, a 15-year-old.
Mm-hmm.
Yeah.
Mm-hmm. Okay. What about the father? He's living with you also?
No, his original father, biological, is now with me.
Mm-hmm. Anyone in the home drinking alcohol or smoking around Jack?
No.
Okay. Any child other than Jack and stepsister in the home?
Yeah, I have 1 month his brother. Sorry, 8-month-old his brother.
Okay. Did you involve with social service before?
No.
Okay. I want to ask you more question about the Jack and his birth and his pregnancy time. Okay. Can
Okay.
you tell me any problem during his pregnancy?
No, he born normally, and I've been discharged on the same day from the hospital.
Okay, that is great. Okay. There is no admission after birth and nothing like that.
No.
Okay. Did he developmentally grow normally like other children?
Yes.
Okay. Did he up to date vaccinated?
Yes, he is vaccinated, immunized, appropriately. Yeah.
Yes. Okay. Does he have any other medical condition?
No.
He have any allergy for any medicine?
No.
There is any medical disease running in your family?
No.
Okay, that's great. Can you tell me what is your concern?
I just want to see my child. Where is he? I really want to see him now.
Okay, no problem. We will do that soon. Like I told you, when there is the injury, we cannot fully explain or seem a little bit unclear for us. There is this process that we follow. Okay. Just we want to make sure that everything is okay with Jack and Jack is okay and safe. Okay. Like I told you, we will need Jack to be admitted with us for a while. We will now we are already just treat him from the burn, okay, and we will discuss this with a specialist doctor, pediatric doctor, and maybe there is some other people they will come and like ask you a few questions like social service or something like this. All this we want just to be Jack in the safe condition, okay, and don't worry about that, okay.
Why? You think so? I'm lying to you, or what? That you don't want to let me go with my child?
No, I didn't tell you that. I'm just I want to make sure that Jack is okay and he will go safely to his home, okay, and to his safety is our priority, and you know that, and I know you are also concerned about him. You can be with him till we finish all that, okay?
Doctor, I really want to see my child. I want to take him home. I don't feel good.
I know that, but like I told you, we don't know how this burn happened. You told me there is iron and they fall in his inner thigh and his back. All these injuries we cannot understand it because when we have this like this injury, we don't understand or not clear for us. I told you that is a routine procedure. We did it for every child to make him safe and sure that he will go to safe place.
Okay.
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 Okay. Thank you.
Thank you.
I will be here if you want anything. Okay.
Thank you. Very good. Excellent test name. So you did very well. But yeah, you did well. So what do you think? Why this child had multiple? Do you think the mother's problem or the stepsister?
No, the stepsister.
Yeah,
15
likely. Yeah.
Yeah.
Yeah, likely the sister has did it, and so you need to say her that I need to admit your child, and the pediatrician, we are giving the treatment also about the burn, and we will do some investigation, full blood count you need to mention. Okay, and also, yeah, you did overall well. I don't think so anything left behind. Good, excellent.
Thank you,
Social
Doctor.
service, yes, and the angry, I didn't get angry. I actually am not a good actor, but maybe you find a patient. I'm not very good actor, to be honest, and I don't know how to do the acting. But I want to tell you, maybe during examination that the actor maybe cry in front of you, tearful. To be honest, so it can be possible. Maybe first he aggressive or she aggressive, and then maybe tearful, because the child problem. So in this case, and sometimes when you don't ask the carer or the mother about another carer at home, if you miss this one, for example, if you don't ask me, so how would I tell you that he has a stepsister, 15-year-old? Of course, I not tell you, right? Maybe I ignore it, so you cannot reach. Maybe you think the mother did it, but it can clear cut here, clear picture that the stepsister should be involved in it. Okay, good, excellent. So let's come up to next one. Who wants to try? Doctor. Okay. Let's come up to this station.
Hello, I am Dr. Medina. I am AD registrar. May I confirm your name and relation to the patient, please?
Yeah, I'm the mother of this child, Jamie.
Okay, nice to meet you. What do you know so far about your child?
Yeah, yes, this doctor, I brought bring child here for he has the sniffle. He complained about some yeah, and running nose. So I brought it here, and I don't know. I don't see him now. I don't know where is he.
Yeah, he's in between the safe hand. Don't worry. Our colleagues, they are taking care of him. I want to discuss with you regarding your child condition. Because actually my colleague here just assessed him, and while he assessed him, he X-ray, and unfortunately the X-ray shown fracture. Do you know about that one? Process in his arm?
I have no idea. Maybe fall down. Yeah, he fall down one time, but I didn't know it's fracture. He said a little bit pain. Then he didn't any complaint. Yeah.
Okay. So when did this happen?
Yeah, it's happened 2 days ago.
Okay. Sorry for hear that. So do you seek any medical help? Do you take him to any hospital?
No, doctor, he doesn't need a medical. He just he has a little pain. He's okay then. Yeah.
Okay. Okay. So where he live? He live with you or
Yeah, he
with
lives with
whom?
me. With me.
Okay. So any
No. No.
Okay. So where is his father? He knows about his condition now?
His father is no more with me, so I don't know where is he.
Sorry for his that. Okay. So anyone in the home are smoking or drinking alcohol?
Yeah, sometimes I smoke. Yeah.
Okay. So any drinking alcohol?
No.
By any chance, any using of illicit drugs?
No.
Before any visit for a social service, your home regarding
No.
your child? Any other child is there at home?
No.
Okay. So I want just ask you, during pregnancy, any problem was there?
No, he born safe, born normally, and I discharged same day.
Very good. So no admission, nothing. Okay. So and where you are noticing, how you are noticing his growth is growing normally?
He has some problem. Doctor told me he has some problem with his health. I don't know how to say here. You can say that he doesn't talk normally. Yeah.
Okay, sorry for hear that. And he's vaccinated. He's vaccinated up to date.
I did vaccination. Yeah. Yeah.
Okay. So any okay. So any past medical history for him?
No.
Surgical history?
No.
Any prescribed drugs?
No.
Any allergy?
No.
So any disease running in your family?
No.
So can I know what is your concern?
I just want to treat him, give him the Sothor medication, and then I go home.
Okay, okay. So according to your data, you give it to me. Actually, let me to just summarize. You told that your child came today by sore throat, and actually my colleague, he did some X-ray and he found a fracture in his humerus, unfortunately, and also he have some learning problem, and he is not vaccinated, and you are divorced with his father, and no other past medical history for him. So according to this data, we need just to admit the child today because we need just to see him by my senior doctor, pediatrician, and also the social service they have also to look for him. Okay, because unfortunately, just the history is irrelevant a little bit with the findings that we found. So we need just to screen the baby. We need to do full blood test for him, and also we need to do a skeletal scan from his head to be sure he's okay. Okay, and also just we will update you for all the thing. Okay, are you agree my plan?
Okay. I don't know why you want to
Okay.
involve social service.
Because actually we are concerning about his injury because in this age it is just not like common to be fractures in this long bone in his arm and this one, and that is why we are a little concerned. So we need just to be sure he's fine. After that, we will discharge him. Do you have any other questions?
Doctor, just give medication. I want to go home.
Um, uh, Sorry, I told you this is a plan for the patient because we are just suspecting, the patient is suspecting non-accidental injury according to his age and according to his injury. That is why we need just to admit and my senior to see him, as I told you, and social service. And you have to agree this plan because you are the mother, and I think your baby health, it is also very important for you.
Okay.
Okay. Okay. Thank you so much for your information. You give it to me.
Okay. First of all, I'm not very good actor. You might have very different way, but anyway. So the things I want to tell you about management plan, you did overall good, but the concise a little bit very important. First, you give the first aid to the baby. You should say, I will give the painkiller to make him comfortable. Okay. Involve the pediatrician, admit under the pediatrician, do investigation, some tasks including the scan of his skeleton or his body. Okay. And also I have great concern. You need to mention I have great concern about the broken bone, which is not common in this age. So I'm going to involve the senior consultant of our department and also social services. Okay. So then she maybe say no, etc. So you need to support and empathic. Like you need to say here, I understand it sounds a little bit, I understand it's natural you feel that way, but I know your mother, it's very important for your child's safety and his health. So we need to involve it, and that will be better for your child's safety as well. So this way you can communicate with her, and she can be aggressive, but sometimes anyway, this mother can be guilty as she is diverse, and this baby is only one, and he has a problem with his health, or maybe she can involve in this situation because she doesn't have another cure too. Okay, so let's go to next station. Who wants to do next station? Anyone? Okay, I don't know what's his name. Abul Jasim.
Yes,
Okay.
yes, doctor.
Yeah, Abul Jasim, so this is your station.
Yeah, okay. Hello. I'm Dr. Abbas Abul Qasim, ED registrar. May I know your name and relation to the child?
Yeah, I'm the mother of this child, Leo.
Nice to meet you. May I confirm his age, please?
Yeah, he is 4 years.
And name?
Yeah, he is Leo, 4 years old.
Okay, I like to take information about his condition. Is that okay with you?
Okay.
Do you want anyone to attend with us?
Okay.
Okay, is he on pain? I can offer painkiller or medicine before we proceed for the history.
Yeah, he's okay.
Okay. So can you please tell me more about what happened?
Yeah, doctor, I don't know, yesterday he came back from nursery, and he had a fever around 39 degree, and I check on thermometer, And I gave him the paracetamol last night and also this morning. And he's a little bit better with that. And now he also has a running nose and cough. And then
Sorry for
later,
that.
and then later I found that I don't know what's happened. He was shaking, his eyes roll up, and I was so much worried. Yeah.
So when did it happen, this shaking?
Yeah, today morning.
Today morning. Okay, sorry for that. Where it happened, at home or nursery?
Yeah, at home.
At home. At home. How long it last?
It's lost 2 minutes. Yeah, around 2 minutes.
2 minutes. Did he completely lose his awareness?
Doctor, he was totally stiff. His eyes roll up. Yeah.
Did he bite his tongue?
I didn't find it.
Did he wet his clothes? Sorry for that.
Children always wait.
Okay. Did he have similar condition before?
Yeah, 2 years ago he has the same problem. One time.
Did it happen with same fever or without fever?
Yeah, fever. He has the same condition and 2 years ago.
Did you seek medical help for that? Did you see a doctor?
Yeah, I take him to hospital and they give medication. They discharged me on the same day. His test was normal, they said.
And what they told you at that time? Did the doctor tell you anything about?
No.
Okay. Any family problem similar in your family? Abnormal shaking
No.
like this in the family?
No.
Okay. Any skin rash? Did he develop any skin rash?
No.
Did he complain about headache or
No.
neck pain?
No.
Did he complain any pain in his tummy?
No.
Throw up? Did he throw up?
No.
Did he develop any pain or pain when he pee?
No.
Okay. May I know? I will ask you some question about did he deliver normal when you were pregnant with him? Did he have normal delivery?
Yes.
Any complication happen when he was growing up?
No.
Any problem?
No.
Is he vaccinated up to date?
Yes.
Okay. Did he visit the emergency department before? And for what?
No.
Okay. Any family history
No.
of any problem?
No.
Is he a regular medication?
No.
Any medical problem he suffer from?
No.
With whom did he live? Who take care about him?
With me?
Okay. May I know what your concern?
I don't know what's the matter with him. This could. I'm worried about what's the problem with him.
Don't worry, I will explain for you. I will shift him to observation room. I will do examination for him. I will examine his neurological system. I will examine his chest and throat. Mostly he got this shaking because of the fever. This called febrile seizures. So we need to do for him some investigation. We'll check the viral screening, and we'll do blood test for him. We'll check his blood sugar. We'll do full blood count. We'll do blood culture, and we'll treat. We'll give him treatment for the fever, and also we'll involve the pediatrician. Do you have any question?
No, thank you.
Did you understand my plan?
Okay.
Okay, doctor. Nice to meet you. Nice to meet you.
Okay, thank you, Abul Jassim. Okay, guys, what is the management plan for this? Is the seizure is less than 1 minute? Just 2 minutes. So what you will do? Discharge him, right? With the safety net.
Yeah.
Discharge him. You don't need a pediatrician. You don't need nothing. This just reassure and give the advice about what advice this should be avoided. For example, don't give anything in the mouth while seizing. Any harmful things around the baby should be put away. Okay, control the fever. These all things you need to give. So it's just a safety net and advise and destroy this patient. Number one. Number two, Abul Jassim, you took very long history. You're supposed to take a relevant system. Maybe you should ask any numbness, weakness, and the temperature and miscellaneous, and then just go for the social history, or you go for the antenatal and also the birth history. Just skip this all other system. It's not relevant. Okay. Because this mother already told he has a sniffle, he has running nose. It's also a common cold, maybe it's high fever. That's why he has a febrile seizure. So don't go very long history, just make it short and then go for the management plan. Okay. Clear? Okay, let's come up to the next station. Who wants to try? Any other? Let's see, what is the station first? Okay, so who wants to do this station, guys? Anyone?
I can do.
Okay, good. Him, please.
Dr. Kashif.
Okay, Dr. Kashif, go ahead.
Good morning. My name is Dr. Kashif. I am ED registrar today. May I know your name and relation to the child, please?
Yeah, I'm the mother of the Joan.
Okay, nice to meet you.
Yeah, nice to meet
How
you.
can I help today?
Doctor, where is my son? I want to see him.
Okay, sorry to hear it. Your child is in safe hand. I have moved your child with my team to the resuscitation area. Okay. Can you tell me more about his complaints? What exactly happened?
Yeah, in the morning, I just gave him feeding and led him to put down in CAT, and then I don't know what's happened. Suddenly he turns blue, and his breathing was very fast for a couple of minutes, and then.
Sorry to hear that.
Yeah, I was really confused what's happened, and then after a few minutes, few seconds, he is going fine, and then I suddenly called the ambulance. Yeah.
Sorry to hear that. And what do you think? What is the reason behind this event?
I have no clue. It's first time.
And what happened before? Such event happened in the past or no?
No.
Did you notice any jerky movements
No.
And did you notice any froth, any foam in his mouth?
No.
Did his eyes rolled up?
No.
Did he lose his consciousness?
I don't know. I just saw him. He turns blue. He's breathing very fast. Yeah.
Okay, sorry to hear that. And did he recover fully after this event?
Yeah, he's okay. He was okay.
Okay, nice to hear that. Is there any bleeding from any orifices?
No.
Did you notice any weakness of any of the limbs?
It was floppy, I found. For
Okay.
short term.
And after recovery, he's fine.
Yeah.
Okay. Any high temperature?
No.
Any lumps and bumps in the body?
No.
Any loss of appetite or loss of weight recently?
No.
Okay. Any past medical illness?
No.
Any past surgeries?
No.
Any prescribed medications?
No.
Any allergies?
No.
Any disease that run in your family?
No.
He lives. Where does he live and with whom?
With me. And downtown.
Okay. Where is his father?
His father is at work.
Okay.
Call him. He will
Did
come
you inform
soon.
him about his condition?
Yes. He will come soon.
Any other carer apart from you?
No.
Did anyone at home by any chance smoke, drink alcohol, or use illicit drugs?
No.
Okay. And by any chance, social services involved previously or currently with your child?
No.
Any other children at home?
No.
I want to ask some more questions. Was the pregnancy of your child was normal?
Yeah.
His birth was normal?
Yeah.
Any problems after birth?
No.
Is he growing normally?
Yeah.
And his immunization up to date till now?
Yes.
Okay. And you noticed that this episode was only one.
Yeah, first time.
And he was born normal at term.
Yes.
Okay. Nice to hear that. And would you like to add anything?
No.
What is your concern today?
Is this a serious problem to my baby?
Don't worry, my team is looking after him, and we will soon update you regarding his condition. And what is your concern?
I don't know what's wrong with him.
And according to the data I gathered from you, your child is suffering from a condition that is called, in medical term, it is called BRUI, brief resolved unexplained event. And according to his data, his age is 2 months, and there is no history of prematurity, and he is having only one event, one episode. So I will categorize him as a low risk for this event. And so there is nothing to be worried about. I will keep him in a resuscitation room. We will examine him thoroughly. We will ask the pediatrician to come and see him also. And we will do some blood. I will do one ECG for him. And After that, if your child workup is normal, then I will discharge him and I will advise you regarding few things. Already there is no one smoking at home. You should follow up with your GP next 48 hours. I will train you about the CPR, that if such conditions happen at home again, you should be trained enough to do cardiopulmonary resuscitation. And I will give you printed leaflet regarding the safe sleep. You should follow that, and I will discharge you with a safety netting, that if any of the danger signs and symptoms come again, like any jerky movements, any prolonged loss of consciousness, or this floppiness, you can come at any time again. And do you agree with my management plan?
Okay.
Thank you so much. Any question you want to ask?
No.
Thank you so much.
Okay, Dr. Kashif, the patient already in the research room, okay? So first of all, you go with the how much so far, okay? Anyway, no problem. If you go that way, no problem. But you follow the approach of event approach, which is adult, okay? There's some question or not relevant. So you need to be a little bit careful, okay? Next time to make sure that you don't need to ask this question. And this antenatal social history, this all you ask in the end, you need to ask first, okay? So more concerned, these are relevant. Relevant things always ask first, and the irrelevant go for the last if you want to ask, okay? So you bring up these old things first. For example, you're going for antenatal or birth history, you need to put it up first after the approach, which I gave in a pediatric approach. So you need to follow this. Any headache or this, of course, we don't know. This is a very young child and brewery event. So this doesn't make sense to even ask about this, okay? The child will never tell you this, he has headache, or even you cannot get a swell, because a child can be swell anytime, can wet itself anytime. So we are not sure when exactly. So these are irrelevant things, okay? Bleeding from orifices, the mother already told you this baby turns blue. That's indicate more likely the brewery, right? So don't go for this kind of question like any bleeding from the ears or anything. No, it's not relevant. Anyway, good try, and management plan is good. Yeah, this patient is low risk, so you need to discharge with ceftonate, training CPR. Okay, so you did very well. Okay, so next one, who wants to try?
Sorry, in this case, I should not call, I think, pediatrician for him, or should I call a pediatrician for him?
You don't need. You need to discharge this patient.
Yes. Okay. Thank you.
You don't need to call. Where not necessary, don't need to call. But that means you put it means you are doing referral not necessary. It means these referral, unnecessary referral you are doing. So this is competency. Your competency is affected. Means you are not a good competent. Okay. Okay, so let's come up to next station. Who wants to try? Other all the stations are very simple and very easy station. Who wants to try?
I will try.
Okay. So it's just a limping station. So limping is straightforward, and we will focus on common station. Who wants to try? The name? Okay, go ahead. Did you read the notes, or you want I show you?
Yeah, show me, please. Okay. Hi, hello. I'm Dr. Tuiba. I'm an emergency physician here. May I confirm your name and relation to the patient, please?
Yeah, I'm the mother of this child. Name is Johnny.
Okay, nice to meet you. May I know what happened to Jamie?
Yeah, doctor, since the last 2 days, I'm noticing he cannot walk normally. And he complained. I asked him, and he said he has a little bit of pain. That's why I'm really concerned, and I brought him here.
Yeah, so this problem started suddenly or gradually?
Yes, yeah, suddenly.
Yeah, and does he have any trauma?
I
Injury?
have no clue. He didn't say anything like that.
Okay. So it is only in one limb or 2 limbs?
No, it's on the left side.
Okay. Can you tell me exactly which part, or you cannot?
Yeah, I think it's near a hip bone.
Hip bone. Okay. Did you notice that the hip bone or the joint it is getting bigger than other? I mean, it's swollen.
There is anything like that. I don't say anything.
Okay. There any redness?
No,
It is warm to touch?
no.
Okay. Did he had any fever?
No, he doesn't have any fever. 2 days ago, he has running nose. Yeah, in that time. Yeah, he has.
Okay. So he has only running nose in the last 2 days.
Yeah, last week he had his running nose, also fever, but now don't have. He's just pain, and he doesn't know how to walk nicely. Difficult in walking, I found.
Okay. I want to know if he has any past history of admission.
No.
I want to ask also about his pregnancy. Is he born at full term?
Yeah, born. Yeah.
Yeah.
Normal delivery. Yeah.
It was normal delivery.
Yeah.
Okay. Is he vaccinated up to date?
Yeah.
Okay. Is his development appropriate with his age?
Yeah.
Okay. Who's taking care of him?
Yeah. I take care of him. Live with me.
Okay. Okay. Anybody with him at home?
Yeah,
Living
he
with him
has.
at home?
He has a little brother, 2 years.
Okay. Where is his father?
Yeah, his father is at work.
Okay. So you are living, you and his father and his son, his brother.
Yeah.
Okay. Sorry for this question. Is there anybody who smoke or drink alcohol at home?
No.
Okay, good. From the information I get from you, this child most probably has simple inflammation in his hip bone. The history you give me that he has few symptoms. So we need to examine him. Check his vitals. If it's confirmed that it is simple inflammation, which we call synovitis, so we'll be discharged home with some painkillers. We will also advise him to take rest. Within few days, it will be sufficient. And we will give you also a leaflet when to come back to the emergency department if required.
Okay.
Do you have any questions for me?
No.
Okay, thank you.
You're very fast. And you didn't go for systemic review. How did you know that it's transient synovitis?
From the history, only the patient does not have any fever.
Yeah,
And history
you didn't ask me about the fever. Does he has any temperature, night sweat? Did you ask me?
yeah, I asked if he has fever. You told he has only flu symptoms. Like,
Okay,
yeah.
okay. I mean, you need to go with quant-size with the systemic review also relevant, like any numbness, weakness in that limb, okay? Any rash around that limb means more concise, okay, to the point. And then you need to also go for the eyes, summarize, because you follow the ODPARA approach, okay? So these all things you need to ask. The previous station which we practiced, that was the life-threatening. 2 words like febrile seizure or the Brui life-threatening station. And the other than two were non-accidental, so this is a little bit different than this one. Anyway, good try, thank you. So next, who wants to try?
I can try, yeah.
Kashif, right?
No, that's Yusuf.
So what's your name?
Yusuf.
Okay. Okay, start.
Okay. Hello, my name is Yusuf. I'm one of the ED registrars. Can I confirm your name, please, and your relationship to the baby?
Yeah, I'm the mother of this child.
All right. Nice to meet you. So, can you tell me what's going on?
Yeah, I found from last 2 days my baby is coughing badly. And it didn't get better in 2 days, so I just came here to check up. I don't know what's wrong with them.
All right, I'm really sorry for that. How is he at the moment?
He's okay now, a little bit better.
All right, is he comfortable at the moment?
I think he's not coughing, yeah.
All right, okay. So I just would like to ask you a few questions about his general health. Is that okay with you?
Okay.
Okay, so can you tell me more about his cough?
Yeah, he started last 2 days. He has this cough, and I found he has a running nose, yeah, too. Sometimes I feel he maybe has noisy breathing, yeah.
Okay, all right. So how did it started 2 days back? Was it suddenly or gradually?
I think suddenly, yeah.
Suddenly, okay. And you said it was 2 days ago.
Yeah, but last 2 days.
All right, and how bad is it?
It's just it's the same, but it's not improving, so that's why.
All right, okay. And it's still the same at the moment.
Yeah.
All right. Is he struggling to breathe with the cough?
I found, yeah, but I found a little bit on his chest. This was a bit like he's trying hard to breathe, yeah.
Okay, so you're thinking that he's working hard to breathe?
Yeah, I think maybe, yeah.
Okay. And have you noticed any temperature with the cough?
Yeah, he has a temperature today. I gave him paracetamol. It was not very high, but he had it.
Okay. And apart from the temperature, have you noticed any other symptoms?
No.
Okay. Is he vomiting?
No.
Have you noticed any runny nose with the temperature, with the cough?
Yeah, doctor, I said, yeah, he has runny nose.
Oh, okay, sorry for that. How is his eating and drinking?
His eating is okay. Yeah, he was eating before, now drinking more than eating. Yeah.
All right, okay. And is it the first time for him to have such a condition?
Yeah.
Okay. All right. Do you think that he has any tummy pains?
I have no clue.
Okay. Do you think that he was crying?
Yeah, he's crying sometimes. Yeah, due to cough. Yeah, after that.
Okay. When you change his nappies, do you think that he was crying when he passed urine or he wee?
No.
Yeah. Okay. And have you noticed any skin rash on him?
No.
Okay. All right. So I would like to ask you regarding his during his pregnancy. Have you had any problems during the pregnancy?
Yeah, he born normally and I happened to destroy on the same day.
All right. Okay. And was he a product of normal vaginal delivery or?
Yeah, I said normal delivery. Yeah.
Normal delivery. Okay. And after the delivery, has he had any problems?
No.
No. Has he ever been admitted to the hospital for any reason?
No.
Okay. And is he on any regular medicines?
No.
Is he allergic to any medicines?
No.
Oh, okay. So where does he live at the moment?
With me and his father.
Okay. And his father. Okay. Where is his father at the moment?
At work.
Okay. And what do you do?
I'm also work in a company.
Okay. And during your working hours, where does he stays?
Yeah, I stay with my mother.
Okay. At home, is there anyone who smokes or drink alcohol?
No.
Okay. All right. Okay. So, what's your concern at the moment?
What's wrong with this baby? I'm worried about his health.
Okay. All right. So, from the information you told me, I think the most likely cause of his cough is a condition called bronchiolitis, which is inflammation of his airways. The most likely it's a viral inflammation. It's due to the virus infection. So I would like to check his observations first, to check his oxygen saturations and his respiratory rate, and then I would like to conduct a clinical exam. So I'd like to listen to his chest. And then based on the clinical examination and the observations, we will have a decision whether to keep him or in the hospital or to discharge him. Usually the treatment for such a condition is it's just supportive treatment, which is we just need to do a regular suctioning for his nose and to give him some fluids if he's unable to eat or drink. Are you following me so far?
Yeah.
Okay. So do you have any questions?
No.
All right. Okay. Thank you very much.
Thank you. Some question you went too far means, some too much questions. Anyways, okay, no problem. The management plan, you need to do suction. Do you think so in bronchiolitis?
In some cases, yeah, I think.
And you don't need to do suction, okay? According
Okay.
to the NICE guideline, okay? So don't need to do suction. So the treatment, okay, good, but you can say if I found the saturation is less than how old is baby? 4 months, right? So
Yes,
bronchiolitis
4 months.
common. So yeah, so in this case, the saturation, if it is less than 90%, okay, and the respiratory rate, you should mention that if the examination showed or the examination findings or saturation less than 90% and respiratory rate greater than 70, I will admit your child here in the hospital, and I will give him the oxygen, okay, if required, and also pass the NG tube, or you can say pass a tube from his mouth to his stomach to give him fluid, because this patient required NG tube. Okay.
Okay.
So this is according to the NICE guideline. But if you think if you need to mention, if I found that his examination findings, or if saturation greater than the 90% and the respiratory rate is normal, so in this case I will discharge him. This condition will be resolved by its own within few days. Okay, but you need to keep hydrate him, and also if there are any severe symptoms, like you need to mention like grunting, like nasal flaring, chest resuscitation, or if his intake means fluid intake is 50 to less than 50, or 50 to 70%, and no wet nappy, or you can say no urine. In this case, you can come back to the ED. So this is also, you need to tell the mother to recognize the red flag. Okay.
Okay.
Yeah. So you need to be very careful when no suction. Okay. Don't do suctioning. It is there's nothing mentioned in the NICE guideline, so it will affect your score. Okay, so let's go for next station we are going to have, and also check this ODPORA. You did well, and then systemic review. Quickly, just go ahead. Just relevant, ask a little bit deeper, because relevant is respiratory, right? A little bit deeper, 2-3 questions, and other just go very fast. Don't waste a long time, or don't more time. Then you come up to the birth history, antenatal and birth history, and then development or immunization, then social history, then past medical history, then rest of things. Okay, good try. Next is Dr. Medina, I think her name is. Okay. Okay,
I did
so
once, doctor. If anyone who wants to do, it's okay.
any other
Maybe
new
my hand is raised for a long time.
any other candidate want to practice other than the one who did already? No one? Okay, so let's start with Dr. Medina. Okay, so this could be, I think it's the last station. Okay, so let's go.
Hello, I'm Dr. Medina. I'm a woman of ED doctor. May I confirm your name and relation to the baby, please?
Yeah, I'm the mother of this child.
Okay, nice to meet you. How can I help you today?
Yeah, doctor, I know since he born, he was a few days okay, but I'm noticing nowadays he's frequently vomiting. Whenever I give the feed, and he vomits suddenly.
Okay, sorry for his that. Just I will ask you some information. Is it okay?
Okay.
Okay. Okay. So you told that this starts suddenly, right?
No, it's just vomiting. Yes, total. Suddenly, yeah, that's correct. Before
Okay.
that,
When did it start it?
from last 3 days, I'm noticing he's vomiting frequently.
Okay. Okay. So how you seeing this vomiting? Is it in his chest or it is afar?
After every feed, yeah, I see on the chest, come up on the chest, yeah.
Okay. So how bad it is?
Yeah, doctor.
frequency? It is how many times every feed?
Yeah, every after feed.
Okay. Okay. So anything it make this vomiting better?
And I have no clue, doctor. I'm really worried.
Okay. Sorry for hearing that. Just I'm asking you. Just I will help you. Okay. Nothing make it better. Do you give him any medicine? Do you seek any medical advice?
Yeah, today I bring my child here today for that.
Yeah, today. Okay. Okay. So any other associated symptoms you are feeling?
Yeah, yeah. I found that he's angry all the time.
Okay. Any change in bowel habits for him?
No.
Okay. Did you notice any, like you are feeling him, he have some tummy pain?
No idea, doctor.
Yeah, okay. Any changes in his color?
It's okay. I just found that he's very weak now.
Okay. Any change in urine color?
Nowadays, I didn't notice he come up in the urine. He didn't
Okay.
wet his nap.
He didn't notice now. Okay. Any temperature there?
No.
Any skin rash?
No.
Okay. Do you notice any weakness in his limbs?
Yeah, doctor, he's vomiting. Yeah, it's a little bit weaker than before.
Okay. I want to ask you just regarding his pregnancy. He was the normal pregnancy?
Yeah, it was okay. Yeah, normal.
Okay. And you deliver normal. After that, no admission? Any admission after that?
No.
Okay. He's living with whom? Only you?
Yeah, live with me and her father
Okay.
also. Yeah.
Okay. Any siblings is there?
Yeah, he has one brother, 6 years old.
Okay. 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 You didn't notice any other symptoms after you deliver him? No other problem rather than this vomiting now?
No, any problem.
Okay, okay. Just what is your concern?
I don't know. The doctor, what's going on? I'm worried about my baby.
Okay, I'm appreciating your concern. According to the data you gave it to me, most probably your child, your baby, he has something congenital. It is like his tummy, in his stomach, a little bit. It will be thick and trophied, and this one it will not allow for the feeding to go down, and this like obstruction. So this one, it goes to him. This is the kind of vomiting. I want to just to confirm my diagnosis and rule out other differential diagnosis. And we need to do for him a tummy scan to confirm the diagnosis. And also, if diagnosis is confirmed, we need to just involve this pediatric surgeon And we need to do for him a blood test, including CBC and the electrolytes, because this kind of vomiting, it may cause some electrolytes problems. And after that, if the diagnosis confirmed, maybe it need a small surgical intervention by pediatric surgery, and they will just reopen this obstruction, and he will be normal, and this vomiting, it will stop. Do you understand my plan?
Okay, yeah. Thank you.
Okay. Do you have any questions?
No, thank you.
Okay, thank you for you.
Okay, good. Thank you. Anyone who can better concise to give me management plan? Anyone can give me better way?
I will, sir.
Okay, so tell me management plan.
According to the data that I have collected from you, your child is most likely suffering from a congenital anomaly in which there is a narrowing of the stomach outlet going into the intestine, and that is the cause of his repeated vomitings. And I will, in order to confirm the diagnosis, I will keep him in observation. I will examine his tummy, and I will look also for the signs of dehydration. And I will run some blood tests, including CBC, renal function test, electrolytes, VBGs, and I will give some short-term management, and I will correct his dehydration. And if there is any electrolyte abnormality, I will correct this electrolyte abnormality. And after that, I will admit him under the care of pediatric surgeon. He will do a surgical procedure that is called pyloromyotomy, in which they will do a procedure by which this narrowing of the gastric outlet will improve, and his symptoms will improve. Do you agree with my management plan?
Good. Any other one who can give me management plan? I want to see different opinion of guys. Any other one? Okay. Okay, good try, Dr. Medina, and good try, Dr. Kashif. Kashif and Dr. Medina, please give the fluid to the patient. You need to mention, I will give the fluid according to vet flag, 10 ml per kg, according to Research Council of the UK. Okay?
Okay. Especially
yeah,
he halfway, his nabi was dry. Yeah, okay.
You guys are forgetting the fluid. Fluid is very important. Your management emergency, you should give. Rest things you leave on the pediatric surgeons, because you guys are forgetting, so try to avoid that. Very excellent job, the Dr. Kashyap, Medina, both. Okay, so good try. So this was the last station, I guess. I want to check it. Is it last, or yeah, it's last station of today. So this is very, very common station, pyloric stenosis. It came in 2020 twice. So, and also the Brui came up already. Bronchiolitis came twice. So these are very important station. Limping, yeah. Transient synovitis came twice too. So maybe before many times as well, but these are very common station. Okay. Good try. Thank you for coming. If you